Basically, you need to talk to them and try to mix positivity with scare tactics. Because they need to know that there are dangers out there. So you need to mention these dangers from my own experience, from what we see in the hospital. So we have to convey this to the public, because they probably don't know, that they don't see. If they see an accident, they think it's just one accident. And it's not going to happen to me. That's what they think. So when we tell them that it's repeated, and we see horrible injuries, and we see kids dying, and so they start relating to themselves more, and they start taking it seriously. And then the positive things is that we tell them that we have a good system to deal with traumas, and when they come to the hospital, we have an organized system to deal with the traumas. So that's the other aspect of education for the public.
And what is the situation in Oman regarding this aspect?
So we do have quite a bit of car crashes. We have a good road system, excellent roads and highways, but our population is very young. So sometimes when you have good highways and fast cars and young age, it's usually not a good combination, because they do speed. The rate of car crashes in Oman has come down dramatically in the past 5 years because of enforcing laws, traffic laws, and very strict traffic laws. So we've seen that the crashes have come down, and also the injuries have come down.
Well, that's actually a good thing, because people are alive now because of that.
Yes, absolutely. Yeah. And we have a very good system as well. Like the ambulance service is, they're very well trained to deal with the patients on the scene. So that helped a lot in the survival of the patients. Also, we're training a lot of doctors how to deal with traumas, what to do, what not to do, how to avoid mistakes in dealing with trauma patients. That also helped a lot. And as I said, the police and the traffic laws have really helped in reducing the traumas.
And what made you passionate about the trauma? Yes.
Well, I tell you a bit about myself. I finished my medical school in Oman. It's called the Sultan Qaboos University Hospital or University. And then I went to Canada to train, do my surgical training, residency training. I did 3 years in McGill and 4 years in University of British Columbia in Vancouver. During my training, I honestly did not know that there's something called trauma surgery when I went to Canada. It didn't exist in Oman. But when I went to Canada, I found that there is a specialty called trauma surgery, and it was really fun to be in trauma surgery because it's adrenaline rush, and you learn to make major decisions in fractions of seconds. So I really got fascinated by it. Initially, I did not even consider it, but when I practiced it, I really loved it. And you feel that you're the only person between that patient and death. So it really is rewarding when you save a patient's life. And it also, I saw that many of the trauma surgeons in Canada are leaders as well. So they take leadership positions in different aspects of medicine. So they're either head of departments or directors of the residency program. So that also attracted me to that specialty. It teaches you leadership as well.
I understand. So when you left Oman for the residency program, did you know you could choose? You said you didn't know that there was such a specialty.
Yes.
What was the process? Because here in Romania, we are taking the residency exam and then we have specialties to choose from.
Right.
What's the program there?
So the program in Oman is similar to the program in North America. So it's almost exact copy of the system in Canada and the States. So after medical school, which is 6 years, we do 1 year of what we call internship. which is basically you do 4 months of surgery, 4 months of medicine, internal medicine, and 4 months you choose either gynecology or pediatrics. So that's 1 year. During this year, you kind of make up your mind what specialty you want to join. And then you do an exam, but it's a very simple exam, not like your exam here. I heard your exam is very tough. But that's a very simple exam, very basic exam. But you just have to pass it just to qualify for the residency. And then once you pass that exam, you apply. And when you apply, you put your specialty, what specialty you want. And according to your application, you get interviewed. So you get 2 choices. And then you get interviewed in these 2 programs that you chose. And if you do well in the interviews and if you have a good CV, then you get picked in that program. So that's how it's done. But it's not like here you do the exam. According to the score in the exam, you go to true. No, that's not the case there. It's basically based on your interview skills and the CV and how passionate you are towards that specialty.
And your CV consists of extra activities that you've been performing during your internship.
Yes, very good question. So your CV basically, if you have done any international exams like the USMLE or the Canadian exam, if you have done any research projects, if you have published any research projects, and if you have presented in any conference, whether it's a poster presentation or oral presentation. And of course, if you have done any community work, so charity work and community work, that also adds to your grade in the interview.
That's very interesting because it's very important to work for the people as you are a doctor.
That's right.
And what did you do in this context? Did you have?
So for me, it was different because that system was not there when I graduated.
Okay.
It was purely that you apply to the Canadian universities and you wait for an interview. If they accept you based on your CV.
Based on your CV from Oman?
From Oman.
I understand.
Yeah. So they have a few spots that are for non-Canadians in some universities. Of course, surgery is very difficult to get into there because the competition is very hard for these non-Canadian seats. But I managed to get a spot in McGill and I joined surgery. After the interview, I guess I did well in the interview. I don't know.
No. You are here now, so.
So I guess that's the reason. Yeah.
So you also had 2 options to choose from.
No, if you apply to Canada, you apply to just one. The 2 options is when you apply for a local training in Oman, the Omani board.
I understand.
Yes.
And how did you choose that? What made you feel that you would be suitable for that?
So I always wanted surgery. I loved surgery. I thought, I love medicine. I love gynecology as well as a medical student. But I always thought that I want surgery because I felt that it's very much rewarding compared to the non-surgical specialties. I thought that, in surgery, you see the patient, you diagnose the problem, and you fix it, and it's done. Yeah. So that's what really attracted me to surgery. And then you fix it with your hands. You don't rely on medications or, different, other things to fix the patient.
Like time.
Yeah, or time. So that's what I liked, because you own the destiny of your patient. Of course, after God, but you own the treatment of the patient. So that's what attracted me to surgery, and I was always passionate about surgery. So when I applied to Canada, I applied for general surgery, and I got accepted in general surgery. As to the trauma, as I told you, during the residency, you get to meet different surgeons and rotate through different specialties. And then the interest in certain specialty grows. So I liked trauma surgery more. So when I finished my general surgery residency, I did 1 year of trauma fellowship or subspecialty.
Oh, only 1 year. Okay.
Yeah, it just takes 1 year.
Oh, okay. I understand.
It can be 2 years if you want to do intensive care as well. But I didn't want to do intensive care. I just wanted to do trauma.
No, why is that?
Because intensive care is not operative. You don't operate. I mean, it's good to teach you how to, take care of the critically ill patient. But we do that anyways during our residency. And we also do it during the trauma fellowship, the 1-year trauma fellowship. So I thought I wanted to do more of operative practice. I did not want to be like, doing ICU shifts and stuff, because I felt like I'm more of a technical person. Yeah. So I just chose one year of trauma.
And how did your life change when you moved from Oman and you moved far away from your home?
Yes. It was tough. Because, Canada is a beautiful place to live in. But no matter how good the place is, it's still not your home. So we had to settle in. My wife was also with me. She's same batch in medical school. She chose pediatrics. So we were both residents, and we had a little girl with us, Shireen, my daughter. So it was tough to find a nanny to take care of your of your kid. The work hours are very long. We start by 6 o'clock in the morning and we finish by 6 or 7 p.m. Or 5 p.m. on a good day, 5 p.m. So it's quite a hectic life, the residency program, but we managed. Human beings, for me, no matter how you push them, they can adjust. It's just they're afraid to go to that zone of hard work or tough life. But once they are in that zone, they adapt and they start coping with it. And that's what I did.
And that's very beautiful. And I think that the fact that you had a family to be there for helped you a lot. And actually, you didn't move alone, so you moved with your family, and that was helpful, even though it was hard for you.
Yeah.
And that's very beautiful.
Yes.
And how is life in a doctor's family?
Life is good, and I know I had a boy after my daughter Shireen. I have a boy, Hisham. He's 18 years now old. So I always say that it's not the amount of time that you have; it's the quality of time that you spend with your kids. A lot of people are staying at home all day, but they probably don't interact well with their kids. So it's not just about if I'm busy in the hospital, I'm not going to take care of my kids. It's about the time that I'm going to go back home and spend with my kids. It has to be quality time. So that's what I really focused on all through my life. Because I like to take care of my kids. It's something that was very important to me. Their mom as well was very, very very caring for them, and she raised them very well. So it takes many factors to work. Also finding a good nanny to help raise the kids with you. There in Canada, that was tough, but we found a very good nanny, so that she helped us. And in the weekends and stuff, we spent fantastic time. I spoiled them basically, and they turned out well at the end. Nothing in life is easy, and I always say that things that are worth having don't come easy. It needs a little bit of work, and that's what I really found in real life, not just slogans that you read in the internet. If you're aiming high, then you have to suffer a bit. And thank God it went well at the end.
I'm very glad that you told us about your family life, because usually when you're talking to surgeons, they are telling you that you don't have time, that hospital takes you a lot of time, and for example, it's difficult for women that are interested in surgery because they are always told that you won't have time for your family. And I think that's a very good example that family life is very compatible with being a doctor.
Yes,
and with both the husband and wife being doctors.
Yes.
And are you willing for your children to follow medical specialty?
Yeah, both of them, they did not want to be in medicine. My daughter absolutely did not want to be in medicine, so she wanted finance. So she went into finance and she graduated. My son wanted to be a doctor like his dad and his mom, but when I brought him to the hospital to work with me just to get a feel of the hospital, and he loved it. So I was quite sure that he will choose medicine. But then he started talking to residents and he asked how many years is medical school and when exactly are you going to get your salary, and and how much salary when you graduate. And then he came to me and he said, Dad, I love medicine and everything, but I just don't want to spend all this time until I settle. So he chose law. He is taking law.
No, that's very nice.
And I don't force them, so whatever they want to do in their life, it's their choice. But my brother is a doctor. I'm a doctor. His wife is a doctor. My wife is a doctor. But our kids, they didn't want to be doctors for some reason.
There are already so many doctors in the family.
Yes. Yeah, that's right.
If they do have a problem at some point, they will have people to call, so it's okay.
Yes, that's right. Yes.
And because you're so close to your children,
yes.
How are you with students and young doctors?
Yeah, I am very close to my students. Since my residency in Canada, I was very close to my students there, to my colleagues. And when I came back, I also continued to support my students and my residents. I feel that people tend to forget that when they were students, they wanted their professors to support them and their teachers to listen to them and to understand their problems. For some reason, when they transit to the other side and they become the professors or the teachers or the doctors, they start, ignoring the students. They forget what they were. So I didn't, though. I always thought that there are people that made a difference in my life because they were close to me, and whenever I wanted help, I know I can rely on them and go ask them for help. So I decided to be the same towards my students and my residents, and it worked well because I was when I came back to Oman, I was appointed as a program director of surgery. And when I first took over, I noticed that the smart students are not going to surgery and females are not going to surgery. So my colleagues and I, not only me, my colleagues and I made it a mission to attract the best of the best to the surgical program, whether it's a male or a female, it doesn't matter. So we were attracting the best residents or students, graduates, and we did that. So for the past 11 years, we've been attracting the top students and the top residents, and we're having probably the most successful residency program in Oman.
And what are you offering to your students?
Support and respect. That's the main thing. They need to know that they're respected, and professors and doctors in general, they need to understand that they're dealing with the brightest of minds in the society. And if they don't respect that, and they don't deal with them with that respect, then they're wasting a lot of valuable assets to the community and to the society. So I believe that they're brilliant. And I believe that they're very well mannered, and they worked very hard, so they deserve respect and support. So whenever they need us, not just me, but my colleagues as well, we're always there. Our phones are open, we're easily contactable. Nothing like call my secretary to schedule an appointment. Just pick the phone up and call me anytime, even in the middle of the night. Even if for a personal issue, not related to surgery. You know, if you're running through a hard time or having a problem with the family, or you need to take care of your kid or something, you know, we always support them. So that is what really attracted them to the program. So even the females, as you said, you know, they tell them that, oh, if you go into surgery, you will not have a life, and all this nonsense. Does not at all affect their life compared to the other programs. I mean, residency will affect your life, whether you go into pediatrics, medicine, surgery, or anything, because it's demanding. But I did not see that they are worse than the others. Actually, they are better because they are comfortable and they're supported in the program.
Oh, that's very nice. I'm almost convinced myself, to be honest. No, because we do enjoy that, being respected, and when we have that from our professors here, also we are very interested in the subject and in the professor, and we are listening very carefully, and out of respect, even if it's not like the most interesting part of the course, for example, we do listen because it's them who makes the course. And
I think so. And I was also blessed to have a lot of my colleagues that are also on the same they had the same mentality. So the residents will always be attracted to come to surgery rather than going to somewhere else where they probably will not have that many duties to do like surgery, but at least when they're at work, they love what they're doing. That's the idea.
Yeah, that's true. Because medicine is a very difficult field, and it's very stressful and demanding.
Yes.
So having a very good place to work is very, very important.
Yes, true.
And being open to students is probably the reason that you're here.
Yes. That's why I was invited to Romania many times.
Yeah. Now you said it's the 7th time in Romania.
Yeah, 7th time in Romania.
And all of these times you were invited to congresses?
Yes, all medical student congresses.
All medical students.
Yes.
Okay.
Twice in Medicalis in Cluj, and twice in Bucharest, and twice in Craiova, and a third time was online during the pandemic. And now this is the third time in Cluj, going for the heart Congress.
Oh. Yeah. I understand. So
yes, and now Targu Mures.
Yeah, we're very happy to have you here,
Same here.
And that you're here at Marisiensis Congress.
Thank you.
And the scientific team did a great job finding you and bringing you to us here.
It's an honor to be here. I really love the city, and I hope it's not going to be the last time.
No, we are looking forward to meeting you again.
Yes.
Soon, we hope.
Thank you.
No, because we also have other congresses over the year. We are very active university city, so there will be many opportunities for you to come back here.
I hope so. It will be an honor to join in any way or form the medical education here and support you guys.
And having a chance to having seen a little bit about the medical field in Romania, what are the differences that you've noticed between the study programs?
I noticed that, here the medical schools are bigger in terms of the capacity of the students. I noticed that the curriculum that we have back home is more problem-oriented curriculum, which, discussing with students here, they needed more of the problem-based curriculum. The residency as well, when you graduate, the residency choices is different here. You have to do the tough exam, and there you don't. You guys don't have an internship after you graduate, right? After medical school, you go directly into residency program.
There used to be an internship here until some years ago. Yeah, they stopped it. I don't know the reason, but now we don't do it anymore. So
subtle differences, but and here you have like 3 languages, I think: French, English, and Romanian.
We have Hungarian. instead of
Hungarian
French.
as well.
Yeah, Romanian, Hungarian, and English.
And English. Okay. Yeah, so there we only have in English. There's only one language the medical school is taught in. But in terms of number, it's 6 years, same like you. And I think it's the same kind of division, the first 3 years and the last 3 years. It's almost there are many similarities, but a few differences.
And the students, do they differ? Because if the students in Oman are more problem-oriented, is there anything that you see different in communication with students, for example?
I think the students in Romania are very, very strong in organization. Very impressive. I was discussing yesterday with one of the speakers in the Congress. He's from Spain, and he was like, we never have students doing what the Romanian students are doing in Spain. And I told him the same. I mean, we do have the IFMSA, and we have the a yearly student congress, but not as big as the student congresses that are happening in Romania. And it's very impressive to tell you the truth. Very impressive to see what the medical students are doing here in terms of organization and the leadership that they take. It's definitely remarkable. And when I go back to my students, I tell them, like, you know what? Next time we will go together to Romania, so that you mix with the Romanian students as well. Now, when the Romanian students come to our college, because we have a lot of Romanian students who come to Oman to do their electives.
Really?
Or internship. I don't know how you call it here, but through the IFMSA and student exchange. They love the amount of teaching that they get there. But you know, these are, if we talk about the differences, these are the differences. And I'm sure people are trying their best in here and there to teach us for the best they can. The same thing I heard yesterday from the Spanish professor. He said there's a lot of Romanian doctors in Spain, and they're excellent. So they graduated from Romanian universities. So it shows that their medical school is strong. If you export excellent doctors to Europe, that's a good thing.
Yeah, but what do you think? Why do you think these students are not staying in Romania? I mean, there are lots of medical students that are leaving Romania, and even though they receive good quality education, they choose to leave. And
you mean after they graduate?
Yes.
So it's all about what is available for them as opportunities. Doctors, by nature, are ambitious people. Because in order to become a doctor, that means you've done well during your high school. That means it's in your genes to be ambitious and competitive. Now you go into medical school and you see that you have worked so hard, and you need to be also rewarded for that. So the reward comes in two ways. One is financial reward, so you need to have a good salary. And the other reward is that you get into the program that you love. So you nurture your passion in medicine. So I think people tend to immigrate or find other opportunities outside if they're not satisfied with either of these rewards. And I think most of them is financial. Because salaries are much higher outside Romania, I guess, than in Romania.
Is this a problem in Oman too?
No, we don't have that many people leaving, because salaries are okay in Oman, and the opportunities are there for employment. Could it be a problem in the future? It could. But for now, we don't see people leaving Oman to work outside. Very few. Like you count them on the finger. But because we're a young country and we have a lot of opportunities. And the salaries are acceptable compared to the neighboring countries.
You're one of the people who actually left Oman and then came back.
Yeah, because it was a scholarship from Oman. So the government was paying for me to go and train in Canada. So that's why, I mean, could I not come back? Yes, I could have stayed outside, but why would I stay outside? You know, it's your country, and the country paid for me to go and learn and study. So I have to pay back my country. That's one. The other thing is that it's life in Oman is really good. I mean, in terms of safety and family and to raise your kids, you know, there are no drugs, no crime. It's a very safe country. So, and it's a very beautiful country. So all the elements. The only bad thing is the weather in the summer. It's very hot. It's very hot and humid. That's the only bad thing about Oman for me. But that's acceptable.
So if we were to visit Oman, when should we visit?
Anytime. But the best time is between September end and beginning of April.
And what can we see in Oman?
So Oman is a very beautiful country. It's a hidden gem. Not a lot of people know about it. So one thing is that you're going to tell people that you've been to Oman when nobody else have gone. So that's one thing that you can brag about. There are many things. There are a lot of resorts on the ocean. So Oman is a country on the ocean. So a lot of resorts on the ocean. It's a very modern country. Very authentic experience. Like when you go to Dubai, it's a different experience. It's like big buildings and skyscrapers and big this, big that. In Oman, it's a different experience where you actually feel the culture of the people. There are the desert, there is the ocean, there are the mountains, there are the city. So it's all-round experience. Snorkeling, scuba diving, water sports, whatever you want, you name it. In addition, of course, if you come as a medical student, there's also a lot of teaching and a lot of knowledge that you can gain during your stay there. And it's a very safe country.
And are hospitals modern? Because you said it's a modern country. Yeah. Is it built for hospitals?
Hospitals are quite well equipped. And it's all paperless. So everything is computerized.
Oh, really?
Yeah. All the notes, everything, all the radiology, everything is almost zero paper. Like really few papers that we use for like consent signing or something, or an ECG when you print it. Even that we're studying to put it paperless. There's a lot of after the pandemic now, the Zoom meetings and the online teachings has also increased. So even after hours we can teach. And there's, as you said, unlike here, because there's a few number of students, then there's a lot of interaction with the professors and the doctors there.
And how do patients feel about talking to students?
When they come to the university hospital, they know it's a university hospital, so they mostly are accepting. Omanis in general are very mild-mannered people, very, very kind, and especially if they see a stranger, they're kind by nature, but when they see a stranger, they're extra kind. So when they see the foreign students, they really welcome them, and they're fine. And almost the majority of people there speak English. So if you speak English, then you're okay to go around the hospital, of course, and go around the country as well.
Oh, that's very nice. Mm-hmm. And that's very good to know, because I'm almost convinced to visiting Oman now for
I can also give you a few phone numbers of Romanian students who came to Oman. Some of them are addicted already. They came 3 times. They came once, and then after that they just came to visit because they loved the country. So yeah.
Can you tell us a bit more about your specialty? And you said that you gave some interviews about population education.
Yes.
And how did that start?
So my specialty, I'll speak about trauma surgery in a brief. I know in Europe trauma is run by orthopedics doctors, but in the North American system, no. You do trauma after you finish general surgery. So we have a very robust system in the hospital on how to treat trauma patients. So there are certain criteria that if the trauma patient who's coming to the emergency department, if the patient falls into any of these criteria, then they have to call the trauma team, which is us, general surgeons. So we go down, we resuscitate the patient, we take care of everything, the primary survey, the secondary survey, and then we decide what other specialty we should call. For example, if there are bone fractures, we call orthopedics. If there's a head injury, we call neurosurgery. If there's a burn, we call plastic surgery. If there's facial injury, we call oromaxillofacial surgery. So we decide. But any injury in the neck, chest, abdomen, we deal with it. We don't call anybody for that. So that's in a nutshell what trauma surgery is all about. It helps a lot because trauma patients are usually multi-system involvement. So they would have a head injury and a bone fracture and a liver injury, So who's going to take care of this? Is it the neurosurgeon? Is it the orthopedics? Or is it the general surgeon? So in trauma surgery, we take care of this patient because we coordinate the management of the trauma patient. If we go see the patient and we find that this patient only has orthopedic fractures, nothing else, so we have cleared this patient from the head, the abdomen, the neck, everything, he only has orthopedic fractures, then we give the patient to orthopedics and we sign off. We do not follow the patient anymore. But if he has 2 or more systems involved, then they stay under trauma surgery. So that's how. In addition, it's good to have this service because, as I told you, we also do a lot of campaigns to educate the public, like the seat belt and the car seat for the children, and speeding and texting while driving, and all these campaigns. We contribute to them whenever there are campaigns either done by us or by other entities. They always call us to go and help educate the public.
Oh, that's very good. That's very good that people are interested in that. But how do you feel when a trauma patients come in?
So, excited first.
Like any doctor?
Yes, because it's very challenging, trauma surgery. I always tell them it's like a Christmas gift. You don't know what's inside the patient. It's always a surprise. And trauma patients are not forgiving. They do not forgive you if you make a mistake. Means if you make a mistake, they die. They don't just have a complication or they get upset. No, they die. So that's why we have to be very, very particular on how to treat trauma patients. So whenever a trauma patient comes, things have to go like a clockwise, like a clock system, like everybody knows what to do. Everybody knows their role. And we have to finish the resuscitation and get out of the trauma room in 15 minutes max. After we've stabilized the patient, we've done everything, put a chest tube, intubate the patient. And then we have to decide where we're going to go next within 15, maximum 20 minutes. So I find it very fascinating to see the trauma patients because, as I told you, there is no trauma patient that's like the other one. Every time it's a new combination of injuries. So it's fun. The adrenaline rush is amazing. And again, the reward is really good because this patient comes in a very critical situation. And if you do well and the patient does well, then you've saved the patient's life.
And have you always felt like this? Like very, not happy, but very...
Positive?
Positive, yes.
I mean, we had the few ones that we felt really sad. Some of them actually broke my heart. But this is the nature of medicine, right? In most of the specialties, I wouldn't say all the specialties, you will get heartbroken at some stage. I mean, my wife is a pediatric rheumatologist who is a very, very, calm specialty that she only does clinics and inpatient. But, she loses patients along the way because her patients are chronic. So she builds relationships with them. And if the patient, one of them gets an infection, bad infection, and dies, she's devastated. She actually cries. So same thing with us. And I'm sure with many specialties. Now, we don't have time to build relationship with the patient, but the story sometimes is very, very, very sad.
Do you sometimes take these stories at home?
I try not to. I definitely don't tell them what happens in the hospital because it's patient's confidentiality. And I also try not to talk a lot about medicine when I go home. What happens at home is different than what happens in the hospital. Unless there's something I think that they would be interested in knowing, then I talk to them about them. But it's... of course, my wife is a doctor, so sometimes I talk to her about stuff. But for my kids, no. Yeah.
Were you always like that? Being able to divide yourself very clearly from your job and family?
I don't know if I was always like that, but it definitely grows with time. Because, if you have a very tough residency program, tough means time-wise, you miss your daughter. So when I go home, I don't want to waste time sleeping and, complaining about my day. I want to spend my time with her. So, with time, we get trained to compartmentalize our brain.
Would you say that having a family at home was very helpful in the starting years of your career? Definitely,
yes. When you have a very tough day at work, nothing like going back and hugging your daughter. Yeah, and of course talking to your wife or your husband, and they also absorb the negative energy from you. And same thing with her, with your spouse, like we do the same thing, like we listen to each other, vent a little bit. But having a family is really helpful.
I understand, and I think that's very beautiful because I myself am married.
Oh, nice. You're too young to be married. Yeah. But you will feel it when you progress in your medical career. Having an understanding husband is really a good support.
Yeah, that's true. That's very important because we are also both medical students. So
perfect. So you understand each other.
Yeah.
I mean, same thing with our residents. I mean, if in the surgical program in our residency program we have 5 couples in surgery.
In surgery?
Yes. So the husband and the wife are surgeons, residents. And some of them have kids.
Really?
Yes. And they're fine. The kids are fine. Their life is fine. They're not broken. They're not having a miserable life. They're both enjoying. And they're very successful. So why? Because they understand each other. They help each other. And they help each other cope.
Oh, that's very good. That's a very good example. Yeah. And we should hear more about these kind of examples.
Yeah.
Because we tend to forget about the importance of actually having a family and being happy. Because I think at some point we get a little bit absorbed by the fact that we are medical students and then we become doctors. And life is not just medicine for us.
That's right. And it's always also nice or helpful to have a good life outside of medicine.
And what do you do outside medicine?
So like sports, I used to be an actor on TV when I was a child. So that helped form my personality as well when I entered medicine. Going to the gym or playing certain sports helps a lot, keeps you fit. Especially if you're in a surgical specialty, you need to be fit so that you can cope with the physical demand. Or just traveling and having a method to detox, basically, whatever that method is. Some people like reading, some people like going out with friends. You just have to find your niche, what exactly makes you happy, and do a lot of that.
Have you always been interested in mental health, or it's something that developed as you grew?
Yeah, it develops as I train in the program. You tend to learn to cope, and I think this is one of the things that I learned how to in my life. This is one of the things that I learned is how to cope with stress, and don't let it get to you. Don't let it affect your family, and then you're fine.
You're working in a very stressful environment.
Yeah. I always tell my residents, they say, "Oh, surgeons are busy." So I tell them, listen, like, if you are sleeping at home, you are busy sleeping. If you are sitting with your friends in a coffee shop in the evening, you are busy sitting in a coffee shop. If you're watching TV, you are busy watching TV. So if I'm operating in the evening, I'm busy operating. So I'd rather be busy operating than busy sleeping or busy watching TV or busy out with my friends. So they're all busy. So everybody is busy. It's just what busyness is satisfying for you, right? I would not be very happy if I sleep, a lot and do nothing all day. My pleasure is to be in the operating room. So if I'm busy doing that, I'm very happy. And that's what's happening to them. So if you choose something that you're passionate about, you wouldn't mind doing it all day. Provided, of course, it doesn't affect your family life. Yeah.
If it were to affect your family life, you would do less hospital hours?
Definitely. Family comes first. And I always told my daughter and my son, they come first. So whenever they call, even if I'm in the middle of any meeting or any work, I have to pick the phone up. Same thing with my parents, because they come first, and no other priority is there, unless I'm saving a life. That's different, but everything else comes secondary. Yeah. So we do take family and the loved ones for granted, because we know that they will always love us and they will always be beside us. I think most people put the loved ones on a second level unintentionally, because they think that they have a mission to do at work, so they work hard, and then they know that their family is always supportive, so unintentionally they become second best or second priority. That's why I need to reiterate to my family, that my kids especially, that you are the priority. If you need me anytime, I'm there. Call me anytime. If they have an event at school, I have to be there. I attended almost all the events of my kids' school, even though I'm a trauma surgeon, supposed to be very busy. But I attended all their sports events, honoring them in academic achievement or something, and anything. I'm there. When my daughter was studying in Vancouver, Canada, I also took time to go and spend some time with her there. So you try as much as possible to show their. Is it enough? I'm sure it's never enough. So, and that's when the understanding of the family comes, that yes, I will give you my utmost attention, but it's not going to be always enough. So that's the understanding from their side.